Welcome, everybody. Welcome to our telephone town hall meeting. Thank you so much for joining us tonight. We're going to be on for the next hour. I'll have the congressman on in a minute. We want more neighbors to get on the call in this very rainy night. If you have a question, please press 0. That's 0 on the keypad on your phone. If you have a question, please press 7. 7 on the keypad on your phone if you want the electronic newsletter. 7, we need your email address. So I'm going to say this a couple more times, then I'm going to hand it off to the congressman. Again, welcome, everybody. Welcome to our telephone town hall meeting. Again, thank you so much for joining us tonight. We're going to be on for the next hour. If you have a question, please press 0. We see some people are taking us up on that already, and that's just great news. If you want to be added to the email list for email updates, we have people standing by to get that email address. Please press 7. 7 to do that on the keypad on your phone. 7. We have some special guests on besides the congressman on tonight. They'll be introduced. We're taking questions, obviously, on COVID-19, probably the hurricane. Those are two of the main topics. One last time, again, thank you for joining us tonight. Please press 0, 0 on the keypad on your phone if you have a question. Press 7, 7 on the keypad on your phone if you want to provide us your email address for email updates. Congressman Joe Cunningham, please take it away if you would, please, sir.
Thank you so much, and I want to thank everyone for joining us here for tonight's telephone town hall. First and foremost, hope that everyone is staying safe and from this storm that's rolling in. I hope that you all continue to monitor the local forecast, and we're posting updates on our social media accounts, and I hope that everyone takes it seriously as well. So again, I want to thank everyone for jumping on for what is our 12th telephone town hall responding to the coronavirus pandemic. And tonight I'm honored to have Mayor Gregory Habib of Goose Creek on with us tonight. And we're also joined by Dr. Traxler from DHEC, and then also Todd Timmons with the South Carolina Department of Employment and Workforce. And very fortunate to have them and their expertise on here with us to help answer our community's questions. You know, since this crisis began, I've worked in Congress to pass bipartisan legislation to ease the burden that South Carolinians are facing in the face of this pandemic. And in March, the House and Senate came together. They passed the CARES Act, which was bipartisan legislation that delivered immediate relief to working families, small businesses, all struggling to stay afloat. You know, in South Carolina, this legislation signed into law by President Trump, helping keep food on the table and a roof over their heads. And while the CARES Act was by no means perfect, they recognized that the dire consequences of this public health and economic crisis required a level of cooperation that's rare in our partisan political system. So it's a long time that we came together and did the same thing again, especially now that leadership in both parties have allowed unemployment benefits to expire as COVID-19 cases just continue to rise in South Carolina and across our nation. So I'm going to continue to fight for bipartisan progress that addresses unemployment concerns, addresses the need for increased state and local aid and funding for our schools and our hospitals. We're going to continue fighting for that legislation, and our local offices are going to continue working tirelessly to help out our constituents. You know, we've held about 100 virtual events, helped over 400 constituents with their unemployment benefits, and recovered over 40 stimulus checks. And again, as I know you all are all aware, the COVID-19 cases are on the rise in South Carolina. And despite our desire to go back to normal, this pandemic is far from over. So we've got to continue to be vigilant against the threat of this virus. And the recommendation of public health experts, including wearing a mask, staying home when possible, practicing social distancing, washing your hands, cleaning frequently touched surfaces. These are all things that are going to help slow the spread of this virus and reduce the risk of overwhelming our healthcare systems. So I look forward to continue to fight for the Lowcountry's public health and their economic recovery, and I look forward to working with all leaders, state and local, particularly Mayor Habib, who is on the call here tonight with us from Goose Creek. Mayor Habib, I want to give you a chance to address your constituents and maybe discuss a little bit about what preparations have been made in the face of this storm we're facing, in addition to how you all are handling this COVID-19 pandemic. Mayor Habib.
Thank you, Congressman. I really appreciate you guys inviting me on. By the way, your office, Lane and that crew are really good to work with, and I appreciate that very much. Relative to the storm, we work very closely with Berkeley County. We are a distribution site for sandbags and those kinds of things. And we work really closely with that crowd. We've got a good relationship with them, and that's very important. When you're trying to, the storm doesn't know where our borders are. The storm doesn't know where Charleston starts and Berkeley County stops or where Goose Creek is. So working with our neighbors is really, really important. We've done a really good job of that with folks in and around. As on our most immediate level, we're monitoring all of our ditches and all of those sorts of things that come to rise when you have problems like this. But we're in good shape. We're very encouraged by our preparations over the course of the year. This kind of things don't just start yesterday or the day before. It's about how you go about your business. And so we're ready for it, and we're just fine. And working with our municipal partners has been very good. Relative to COVID, we're actually seeing in 29445 and 29486, which are the zip codes that make up Goose Creek, we're seeing active case numbers decline. Obviously, the raw numbers are still increasing, but they're increasing less, and that's what as you guys know, active case numbers declining means, which is a good thing. About 3 weeks ago, I enacted a mask mandate by proclamation. I'm finding that people are really trying to adhere to that. Masks work, and we're seeing the results of that. Again, while they're still going up, our active cases do tend to be going down now. That's, I don't want to take up all the time, so we'll let you guys talk now.
All right. I appreciate it, Mayor Habib. Let's get to these questions and open it up for folks.
Karen is first, and Karen, for Joe, this is your question. Karen, welcome to the call. Karen, go ahead with your question, please.
Good afternoon, Congressman. I want to just say that I appreciate your having these calls to the community and getting answers to us. My question is, with the rise of COVID-19 in triple digits daily in Charleston, how should we go about opening schools and making sure that our partners are with us in making this happen safely, keeping teachers safe and keeping children safe?
Hey, Karen, thanks for that question, and that's at the tip of everyone's mind. I think here in South Carolina, especially folks with young kids. We got a 2-year-old, and obviously, we share all those concerns. I had a good conversation with Molly Spearman a couple weeks ago, the superintendent of education, talking about how different districts are submitting different plans to reopen schools, and it seems like most of them, if not all, are doing it in a hybrid way that allows flexibility between virtual classes and in-person classes. And I think we recognize that it's not a one-size-fits-all, and it's why I had a listening session with teachers recently and listened to their concerns about reopening and the challenges of teaching virtually. Different age groups command different levels of education, obviously, and different methods. So I think the way that it's going about as far as giving different districts the options to do these hybrid ways of opening up to make it safer for not only teachers but the children and then the families they get home to as well, because a lot of parents are just thinking about their own household, but you have to remember that a lot of children live with their grandparents, live with people with compromised immune system. So it's really a danger when you send so many people into these schools and send them back to their homes where they may be spreading germs or virus. So each school district is going to have to follow their own plan as it fits them. But it seems like a mix between virtual classes and in person, and if it is in person in a manner that respects the guidelines of the CDC and social distancing. These are these are the ways that most school districts are going about it. And I think affording them the ability to dictate for themselves, as opposed from it coming from one political office or the governor or a politician. I think this needs to be driven by teachers and educators and parents, and with full buy-in from all. I appreciate the question, though, Karen. I know a lot of people share the same concerns.
Jan, welcome to the call for Dr. Traxler. Jan, go ahead with your question, if you would, please.
Yes, thank you very much for taking my call, and I really appreciate your accessibility, Representative Cunningham, because other people, there are other representatives and senators that are not as accessible, and it really makes a difference. Your office has been very receptive to concerns that I've had. But the big thing for me is that I'm a medically trained massage therapist. There is no way to do massage safely. And so my business has been closed down since March. I am holding my breath every time there's a news conference about what's happening with the unemployment, because that $600 was my lifeline. Now, I know that it's resting a lot on, with the senators and with the GOP, but is there anything that you can do? Is there anything South Carolina can do rather than wait for the nation as a whole to be able to help us? Because I'm certainly not completely alone in my concerns. And there's a lot of people right now that are facing homelessness, and it's terrible. I myself am very worried about.
Joe, you're first. I'm sorry for Dr. Traxler. I think, Joe, you want to take this, don't you?
Yeah, Jan, thanks. I'm sorry this pandemic it sounds like just crippled your business, and I completely understand the situation you're in. A lot of people's businesses have just been decimated through this, especially those that rely on person-to-person like yours. I can tell you, the House had started working on this weeks ago. I was disappointed that the Senate essentially just waited for these benefits to run out before beginning negotiations. But I believe that we can come to the table, Democrats and Republicans, and finally hammer out a solution that affords people who are unable to work, like yourself, the ability to survive. So, and I don't know if Mr. Timmons with the Department of Employment and Workforce has any input to add into it as well.
Yeah, thank you, Representative Cunningham. And I just wanted to say thanks for your leadership from the beginning of this pandemic. You really helped our agency get the word out, and that really means a lot to us. And we're really happy when our elected officials are willing to come alongside us and kind of help us ease people's minds and get the word out about programs that are available to you. As to the lady's question, I think I'm kind of in the same holding pattern that the rest of the country is, and to see what ultimately looks at. The only consolation we can probably provide is that we're tracking this daily like everybody else, and we're going to make sure that South Carolina is positioned to implement whatever it is the policymakers decide. We're not going to be caught unaware. We're going to be ready to go once they just tell us what we need to implement. So we've got the staff in play. We've got a modern system that can handle whatever policy the elected officials choose to implement. So I certainly hear from a lot of people like her that are very worried about these benefits, but we're just kind of waiting to see how it all shakes out.
Let's take another question, if we may, please. It's going to be from Lance. Lance for Dr. Traxler. Lance, welcome to the call. Lance, please go ahead with your question, if you would.
Hi. Thanks. First off, I just want to say thanks, Joe, for having these. I'm a long-time listener, first-time caller. You actually seem like you care about the people, and I just wanted to say I think you're doing a great job so far. Dr. Traxler, my concern is I haven't really been able to dig up a lot of information on if there's any worry about COVID-19 possibly mutating like the flu does seasonally. And my other worry is there any data on what could happen to a fetus, an unborn child, if a mother catches COVID-19?
Sure. Thanks for those questions, Lance. So, I would say the one thing in terms of the virus mutating seasonally is that we really just, a lot of that is still educated speculation at this point until we get a couple more seasons under our belt. We've really only gone through spring and summer with it, and so whether it mutates annually or whether we see mutations occur with colder weather will be, things that we are looking closely at as we go through, the upcoming months and even year. I think so far it is optimistic in terms of how much it is mutated thus far. There have been some mutations, but not significant ones. I mean, so far as you've heard the successes with the recent vaccine trials moving on to their phase 3s, that would not be possible if this was undergoing significant mutations. And thankfully, especially when it comes to the vaccines, a lot of the mutations may or may not, or looking like they may not affect the part of the virus that the vaccine is based off of. In regard to fetuses, this is an interesting area. Is a lot of the research being done and observation being done on the risk of COVID-19 to women who are pregnant and their babies, both unborn and shortly after birth. So far, the limited amounts of data are not showing significant adverse effects for unborn babies. So again, this is still just based off of limited information. There has been some recent data to suggest that pregnant women may experience more severe symptoms, but may not have more significant, significantly severe, outcomes. So I think it's still very early to tell for both of those, but both are key areas that the scientists are keeping a close eye on.
Thank you, Dr. Traxler. I want to remind people if they wanted to be added to the email list, we have a few folks standing by to collect your email address. Please press 7 to do that. 7 so we can send you electronic updates from time to time. 7 on the keypad on your phone. We need that email address. Let's take Larry next. Larry, going to Joe. Larry, welcome to the call. Larry, go ahead with your question if you would, please.
Okay, thank you. This is for Dr. Traxler, actually.
Okay.
We're originally from Ohio, and we watch the Ohio Governor's News Conferences every Tuesday and Thursday regarding coronavirus. And based upon what information we've received from that, my questions are, the positive cases, there were 1,100 today, which was probably low because it's a month. The question is, Doctor, are positive cases that are identified required to quarantine? How many of those positive cases are subject to contact tracing? And third, not to make this too long, we keep hearing about an R number. Does South Carolina provide the rate of infection number? Thank you.
So those are great questions, Larry. I can tell that you are keeping up with all of the information in the news. So we do ask that all people who test positive do self-isolate for 10 days or sometimes longer, depending on their symptoms. After their symptoms, 10 days once their symptoms begin, or if they never have symptoms once they get tested. So we do ask that they all self-isolate, which means to stay at home and away from other people. And for all of them, contact tracing is initiated. Now, it is voluntary when DHEC calls a person who has tested positive whether they want to speak with us and help provide the information. But I really very strongly encourage everyone to do so if you do get that call from DHEC after testing positive, or if you're identified as a close contact, because that contact tracing is a key way for us to help slow the spread of this virus, is to learn who somebody's close contacts were while they were infectious or contagious, and notify those people so that they can then quarantine and stay home and away from other people, so in case they come up sick, they won't be spreading it to others. The R number, or that reproductive number that you hear about, sometimes people call it the R naught, which is the R with a little subscript 0, is a number that epidemiologists certainly like to look at, and tells you basically for every one person that's infected, how many people did they spread it to. And we think it's roughly between 2 and 3 for this virus. And so it can tell you about how contagious something is. It's difficult to calculate in real time and does have limitations if we were to use that as our as the point of reference for how severe things are while the outbreak or pandemic is going on. I'd encourage you to look at that percent positive rate instead. And that tells you out of all of the tests that are reported in a day, what percentage of them were positive. And we want that number certainly to be decreasing. We want it down in single digits and ideally even under 5. And that number I think today was 15.2 for South Carolina, 15.2%.
Veronica's next. Thank you, by the way. Thank you so much for that. Veronica, welcome to the call. Veronica, go ahead with your question, please, for Joe.
Hi, how are you? I actually had 2 questions. I was very pleased with Mayor Habib putting in the face mask order for everybody, but the thing I had was, what is the fact of the, I'm trying to word this properly, but like, what is the fact of like people who don't comply with it and nothing being done about that is my first question.
Let's take the first question first if we could. Go ahead, please.
Yeah, Veronica, this is Joe. I just want to jump in here real quick and let everyone know we also had Brian Derryberry from the Metro Chamber of Charleston join us a few minutes ago to talk about COVID-19 and its impacts on local businesses. But Mayor Habib, I didn't mean to cut in. I'll let you go ahead and address what the penalties and fines are under the recent ordinance and maybe some of the reasoning behind it.
Well, keep in mind, we had an ordinance presented to council that council vetted down that included some rather significant penalties and fines. There's, not everybody's, the one thing folks need to understand is that at any given point, 50% of the world disagrees with you. And while we value that masks are important and that they work and we want everybody to wear them, it was just a real hard sell to get folks to criminalize it, as it were. And so that was very difficult. We've worked very closely with our businesses and our business partners and have encouraged all of them to call us if there's a problem. One of the issues is we can't put police officers out on the street for masks, but we can respond when there are issues presented. But, a lot of it, and this is not just in Goose Creek, this is in places where they have criminalized not wearing a mask. The enforcement is very difficult. A lot of folks don't want to take that responsibility. A business doesn't want to take that responsibility, or an employee doesn't want to take that responsibility, and I understand it. What we've seen, though, is compliance is really pretty good, and you're never going to get 100, but we think that the results have been very good, and we're seeing those results what our numbers are looking like nowadays.
Congressman Cunningham, can I follow Mayor Habib for a second?
Yeah, of course. Go ahead.
This is Brian Derryberry. I want to thank Mayor Habib and all the mayors in the region that implemented the laws around wearing face masks. One of the things that the business community has been doing is a pledge called One Region, the One Region Pledge, and this is encouraging every business in the metro area to follow the 4 safety protocols of hand washing, wearing a mask, social distancing, and protecting populations that are at risk. We've had over 300 businesses sign that, so they and their employees in their places of business to safeguard their customers, their vendors, and their employees will be practicing that. And you can go to oneregionready.org if you're a business person today and sign up for that. Also, 21 of our business sectors you'll find reopening guidelines with safety protocols. So I think lots of folks in the business community are working very hard to make sure we have voluntary compliance, and we just have to keep encouraging people across all of our communities.
Joe, if I may, the city of Goose Creek is part of One Region, as are several other towns and counties and the like, and I commend the Chamber and their One Region organization. When I said earlier, the virus doesn't know where the borders are, the hurricane doesn't know where the borders are, and quite frankly, the economy doesn't know where the borders are. And us working together under that umbrella has been really a blessing for this entire community, and I've been very proud to be part of it. So thank you, Brian.
You bet, Greg. Just excited for more and more people to adopt those 4 safety protocols.
Let's take another question if we may. Bill's next. Bill, welcome to the call. Bill, go ahead with your question if you would, please.
Hi, yes. One, thank you for taking my call. 2, Congressman Cunningham, thank you for these town hall meetings. And also, I want to thank for staff. They were a tremendous help to me to be able to finally get through to the unemployment division and start receiving unemployment. I did receive 3 out of 7 weeks of unemployment, but I'm still owed 4 weeks, which representatives at South Carolina DEW are more than happy to share that, yes, we owe it to you, but the frustrating part is the next sentence is, we have no idea when we can pay you. Can anybody help me with this?
Hey, Bill, I think, again, I'm glad our office is able to help you out with some of those payments. And for those that are on the call, our Mount Pleasant office number is 843-352-7572. If you have any issues at all with this, give us a buzz anytime. Again, it's 352-7572. We got Todd from the South Carolina Department of Employment and Workforce on the line. Todd, you want to address that?
Yeah, I'm happy to. Yeah, it sounds like something may have broken down in the process. There really should not be a reason why. There's no reason in our system, I should put it this way, why you should be able to get 3 weeks but not the full 7 if you're eligible for the full 7. So that's something we want to take a closer look at. I just can't answer it on the phone as to what might be holding up the other weeks. If there's anything else we need from you, or if it's something, or if the ball's in our court to handle. So if you want to get that information back, it sounds like you have an idea of how to contact the Congressman Constituent Services. If you want to get that information to them, I can certainly take a look at it. I'll have somebody flag it and keep an eye on it.
Yeah, Bill, call us in the morning, and then we can try to close this lid for you.
Thank you, team. Susmita, I hope I said your name correctly. Welcome to the call, and please go ahead with your question if you would.
Hi. So my question is about mail-in voting. I know that South Carolina has mail-in voting in place, as do other states, but there are many states that do not, and getting that implemented by the election time is going to be difficult due to political issues and also the budget and complications with implementation. So what are you doing as what are you doing as a congressman to help the rest of the country to be able to vote by mail for the fall election?
Hey, Susmita, thanks for being on the call, and thanks for submitting that question, because nobody should have to make the decision between exercising their right to vote or protecting their own health by not being exposed to this virus. And I've talked to a lot of people who have some very, very valid concerns about going into crowded schools or libraries or other polling locations where other people may be and being exposed to this virus come November 3rd. We've been encouraging the governor to expand this and encouraging the state legislature to expand this, and because, like I said, nobody should be put in that compromised position. And the time to act, Susmita, is now. Let's not wait till September or October. There needs to be a plan put in place, and to be able to go through, check all the boxes and make sure that that people can request a mail-in ballot and submit their vote by mail, for the reasons of not wanting to be exposed to COVID-19. And so I think that's a legitimate reason. A lot of other states have done the same thing. This is going to be done on a state level, but we've advocated to allow for this, and have been very vocal on this issue. And I hope the state legislature, I hope the governor hears these voices.
Let's take Kimberly next if we can. Kimberly, welcome to the call. Kimberly, please go ahead with your question.
Hi. I guess my question is very similar to the one a few ago, where I've done my weekly claims for my unemployment, and the last check I received was the first Saturday in June, and that was back payment for May. And so I've gone the whole month of June, the whole month of July without getting any kind of unemployment. And I'm just wondering, I've done all I can on my part, and I know I've got the number to call you in the morning, but it's just crazy to have to wait 2 months to get an unemployment check. Luckily, I had money saved up, but this is ridiculous that 2 months have had to go by, and I get no kind of help.
Kimberly, I understand your frustration completely, and we've unfortunately we've heard a lot of these complaints, and I'm sorry that you're in the position that you are. I would encourage you to call our office in the morning, and we'll try to help you navigate through it. Todd, do you have anything you can add to this?
Yeah, the only thing I can say is we have had a delay. I think it's well known that with the volume that we've gotten, the number of claims we've gotten over the last few months, it has taken us a little bit longer to process claims. But 2 months, it doesn't take us 2 months. So I would really encourage you to get that information over so we can take a look at it and make sure something's not going on, because the process, that's a little bit longer than it should take. And also the fact that you've already been paid for some weeks and not others, kind of like the other gentleman's question, it's something we need to take a look at. So please do follow up with them, and we'll see if we can't get you taken care of in a hurry.
Kimberly, I'll give you that office number in Mount Pleasant again. It's 352-7572. And I think your concern, your problem brings up a much larger issue on why Congress has to act immediately in order to extend benefits, because if people are already having such a overlap or I guess a delay in receiving payments, that's only going to be exacerbated by the fact that the benefits expired last week and that we still don't have the solution in place. So I think that just underscores the dire need that people are facing, and the dire need that people are craving for Democrats and Republicans to come together in Congress and hammer out a solution.
Yeah, and Congressman, do you mind if I follow up on that point?
Yeah, sure, go ahead.
Yeah, and I just want to clarify for everyone out there listening, I think, you and I understand that the only thing that expired is the additional $600 in the SPUC benefit. So all the federal programs in the CARES Act, except for that one, still exist. So you can still file for unemployment. We've had we had some people calling in this week that didn't quite understand that. You can still file. It's just your weekly benefit amount is definitely going to be lower, and $600 is a lot of a decrease. But I just want to make sure everyone understands that just because that one program went away, that doesn't mean you still wouldn't be eligible for some benefits. So if you're on unemployment and you hadn't gone back to work, keep filing your weekly certifications so we can get those benefits out to you.
Thanks for that clarification, Don. Appreciate it.
Mm-hmm. Yep.
Thank you all. I want to remind everybody one last time, if you want to get on the email list for email updates, please press 7 on the keypad on your phone, 7, so we can get your email address so we can send you email updates. Kathy is next. Kathy, welcome to the call. Kathy, please go ahead with your question.
Hi, thanks for having me. This question is for Congressman Cunningham. I'm a small business owner in Somerville, South Carolina, and I own like a children's franchise where we have like young babies participate in classes with their parents. And I was fortunate enough to receive the PPP loan, but and I was also fortunate that they extended it for 24 weeks. So thank you for voting to do that. But the PPP in itself, when it was designed to cover 8 weeks. So it was designed for an 8-week time period. to cover 25% of your payroll and 25% of like rent costs and then 75% of payroll, but only for 8 weeks. And now here we're going on 20 weeks of being shut down. A business like mine, and there's lots of other people in the same boat, like massage places, like from someone who spoke earlier, and my line of business, it's going to be quite some time before we can even reopen to a level where we would even begin to cover our bills, let alone be profitable because of this. So are you going to be working with the Senate to do any type of bipartisan, something that's going to help small businesses like mine, or there's other small businesses, like I have a friend who owns a similar franchise to mine, who like they got the PPP loan at the very beginning.
We lose Kathy there?
Sorry, I muted myself too. Yeah, Congress, go ahead and take on Kathy's question.
Yeah,
please.
yeah, of course. Well, Kathy, first of all, thanks for being on the call. And you know, it's businesses like yours, of which we had in mind whenever the PPP was drafted and put into action. You know, soon after the CARES Act passed and the PPP loans started going out, I think we started to see a lot of faults in the system. You know, we saw the 8-week time frame as a major one, particularly with food and beverage industry. How you know, we can say 8 weeks, but the fact is that as municipalities and places shut down, their doors weren't open anyway, so they couldn't pay people. You know, we also saw that some of these guidelines would be 25% towards your rent, and then the other 75% towards payroll. That also commanded a little bit more flexibility because, you know, a business like yours that may be on King Street will probably be paying a lot more in rent than the place out in Somerville or Goose Creek or Monk's Corner. And so, but every small business is different. I think they need a lot of flexibility. I think that's why we passed the PPP Flexibility Act as well. But I think moving forward and these types of negotiations in this next round of stimulus money, we need to take those lessons that we learned through the first round of funding and through the first PPP and apply those moving forward and recognize that, you know, this next stimulus package, there's a lot of things that are being discussed. We've been advocating for help for small businesses. We've been advocating for help for cities and municipalities because of their budget shortfalls. I know stimulus checks are part of the negotiation as well. But our main focus has and always will be small businesses. And because particularly our community, Charleston, the greater Charleston area is made up of them. That's the fabric of our you know, economy here in the Low Country. And so yeah, it's those types of loans and that type of relief for businesses is that we're going to continue focusing on. And I don't know if Brian, with the chamber, if you want to weigh in on a little bit about this. And
Congressman Cunningham, I just want to thank you for the reception your office provided our chamber. Our state and federal lobbyists have been communicating with Congressman Cunningham, along with the rest of our congressional delegation, on the need for a much higher level of flexibility around PPP, and also for extending it to particular sectors that have been harder hit and have different requirements than small businesses that may have recovered more quickly and are back at work right now. So, Kathy, you've expressed something that's really real out there, and we've worked hard to find partners like Congressman Cunningham and his team. And I think our whole congressional delegation is extremely sensitized to the needs of small business. So I would share directly with Congressman Cunningham's office exactly where you see the challenges with PPP. And I know Congress is trying to find a way to understand those unique small business needs, and they're so different by sector and size that they're working hard to accommodate small business, and hopefully we're going to get another good round that'll have more flexibility.
George has a question for Brian. George, welcome to our call. George, please go ahead with your question if you would.
Hey, how are you doing? This is for our representative. We have a small business. We have a small business and has been affected by COVID-19. Rather than taking workman's comp or unemployment, we are trying to open a new business, a coffee cart on a pre-existing commercial property that we own, and we're running into roadblocks with planning and zoning. And sometimes we're not able to talk to them. Everything we put forward, it's been 5 months, and we cannot get a business started with this, which is just a coffee cart. What do I do? Who do I talk to? How do I'm trying my best to be an entrepreneur and use my ingenuity to continue just making money for myself, not taking money.
Thanks, George. Where's your business out of, George?
Charleston County.
You're in Charleston County? Okay. All right. Well, thanks for hopping on this call with us. As it relates to any governmental red tape you run into, call our office in the morning. I'll give you that number again, and we'll try to figure out where any logjam may be. Let me get that number for you. It is 352-7572. And I want to give Mayor Habib a chance to weigh in on how businesses are faring and maybe even increasing through this pandemic. And then Brian, if you have any input for George on, if you've heard of any of his concerns from other businesses or other folks as well, or entrepreneurs trying to start businesses too.
Unfortunately, I can't speak to George's situation. I hope that folks in the city of Goose Creek aren't having those issues. Businesses are struggling. We in the city of Goose Creek, our city council, we just appropriated $250,000 and in a partnership with the LDC, really post PPP money, any other federal programs that may come along. We want to see if we can help folks out who may fall through the cracks there. And so we've put some money together to work with folks to try to get through. It may only be a $20,000 loan, but that may get somebody through 3 months of rent and may be able to help them get back on their feet when that time comes. So we're very cognizant of the issues that our businesses are seeing, and we have seen a decline in some of those businesses. But our folks are plugging away. We haven't seen too many close, and we've had a really good discussions and worked very closely with them in helping them try to see through this.
George, this is Brian Dearberry, and happy for you to also work with our chamber in addition to Congressman Cunningham's office. You can reach me at 843-906-7475, and again, 843-906-7475. Happy to introduce you to the folks in our government relations team that work directly with the folks at the county, and hopefully we can get an understanding of what's going on with your request for a business startup license.
Let's take Pat next. Pat, welcome to the call. Pat, please go ahead if you would.
Oh, yeah, great. Thank you for taking my call. This is about my 6th forum through the teleconference. It's really appreciated. Good information shared. I'm a long-term Democrat, originally from New York. I've been down here in Beaufort County, now food and beverage and hospitality industry for a decade, and it's been a rough go this last year. I'm a little bit embarrassed to be calling myself a Democrat, to be honest with you. I don't like the tactics that Nancy Pelosi and others, Chuck Schumer, are using. Now, you wrote a letter to them on the 24th. I read that letter that you had on your website. It was a very good letter. I don't like them holding up everything because they want to get everything to a big package so they can get some of their goodies passed. Why couldn't they just have passed a week of unemployment the way that it was offered so that they continue negotiation? But no, they want to have people suffer so that it puts more pressure on them coming to agree on a large-scale $1 trillion thing. Now, you helped out with the CARES Act, and Nancy did the same tactic. They delayed for weeks, and people suffered. Thank God it finally passed. Now they're trying to do the same thing with this HEROES Act or HEAL Act or whatever you want to call it. Why does it have to be big? Why can't they do it piecemeal? Why can't?
Your thoughts, please, Congressman.
No, hey, Pat, thanks for joining the call, and thanks for staying on with us. And, I agree with you. When we try to look at what's wrong with our system and what we can pass, if you have an opportunity to do what I call, rifle shot legislation, just narrowly focused, then get it through. And I think we did that with the, PPP Enhancement Act. We recognize there were some faults with the PPP program, and as far as like the time frame and the constraints it put on small businesses, the 25%, 75%, businesses needed a little bit more flexibility. The child care facility up there in Somerville maybe have different needs and different expenses than a bakery downtown Charleston, and not every small business is the same. So when we have the opportunity, I think, to pass these narrowly tailored pieces of legislation, we should. I can tell you, though, that the House has been working on further stimulus package for several weeks now, and I'm a little bit disappointed that we've come to this point right now where we've allowed unemployment benefits to lapse. But I don't really think it does any good to point a finger at Democrats or Republicans. I'm just interested in working together and getting things done. And and that's what we've been doing. We've been writing letters, some of which you've read, it sounds like, advocating for small businesses, advocating for money for municipalities so they don't have to cut police officers or fire departments. But I think a lot can get done whenever people just stop the blame game and actually come to the table and start negotiating in good faith. And I've got to believe that that is coming to a head here pretty soon. And we've called on congressional leadership to take immediate action to extend these unemployment benefits. And you look at it, while our economy has fortunately begun to recover in some respects, the unemployment in South Carolina is still at like a staggering 8.7%. Yeah, and with more people relying on unemployment benefits than at any point during the Great Recession. And I think that's pretty impactful. So, we've heard from a lot of business owners who are worried, and a lot of people who are worried about the benefits lapsing. I got to say, that I do take those to heart, and we are advocating on behalf of those needs, and we're going to continue to as well. I appreciate the question, though, Pat.
Well, and thank you for that. I want to just say I wanted to take a question. I wanted to read it if I could. It's about unemployment from Beatrice. Haven't received anything. What can I do about it? I transferred benefits for my sons who served. I have a personal question about that regarding the transfer of GI benefits, and she's going to leave that in a voicemail. What do you think about what Patria was saying, please?
Beatrice, I would say, contact her. Can you hear me?
Yeah, I'm sorry. Go ahead.
I would say contact our office as it relates to any benefits. As I'm sure most people on the call know, I serve on the Veterans Affairs Committee. We've been, very fortunate with all the victories that we've gotten for veterans, our heroes, our nation's heroes. We're going to continue advocating for them. But to the extent that you all have, there are any issues at all, our Mount Pleasant number is 352-7572, and I'm sure we have Beatrice's contact information. We can follow up with her directly as well.
And thank you. And as I've lost my internet connection for just a second, if you could ask a question of the doctor to get her into the loop on a couple of seconds while I reboot up, I'd appreciate it. So go ahead, please, Congressman.
Yeah, Dr. Traxler, again, thanks for joining us here. Can you give everybody an update on kind of what you've seen in the last 7 to 10 days as far as cases go, infection rate, and what, if anything, that we've learned in the last week or two as it relates to trends?
Sure, and thank you for having me. I have very much enjoyed doing these. So I am cautiously optimistic, I would say, looking at the last 7 to 10 days, even looking really at the last, I'd say probably closer to 2 weeks, because we have seen some change, some decrease, looking at the last 2 weeks worth of case counts, which is certainly very encouraging after we'd had, a number of them where the cases were increasing week to week. We're, I think, on target to have our second week here ending. That's a decrease and so from the previous week, and so that is certainly encouraging. I would say that our numbers are still high, and so we still have a lot of work to do. But I think that we are capable of it. We certainly are seeing, as I said, some of the early signs. Our percent positive rate that we were speaking about earlier has also been kind of going up and down, I would say, but kind of like the waves in the ocean a little bit right now. But some definitely some lows and some highs. But the downward trend, looking at the last 2 weeks, has been, the trend in the last 2 weeks has been downward, which is certainly encouraging. We were sitting out in the high teens, low 20s, and now we're a little bit more in the mid to high teens. And so I want to encourage everybody to keep doing the things that they're doing because they are working. Keep avoiding the large group gatherings. Make sure you're doing that 6 foot or more distancing and wearing your masks whenever you're out in public or around people outside your own household. And there's information even coming out if you're in especially a multi-generational household or one where there's people that are high risk for infection. It might even be beneficial when you're around people in your household to be wearing them. So really encourage everybody to keep doing these things so these numbers can keep going in this good direction.
Thanks, Dr. Traxler.
I'm back. Go ahead, Congressman.
No, go ahead.
Well, I'm sorry. I didn't know if you had to add anything to what the doctor was saying. Did you?
No, I was just going to follow up with Mayor Habib on something else. But if you got a question in the queue, let's get it on there.
All right, I do. I have Ray. Ray, welcome to the call. Ray, thank you so much for getting on tonight. Go ahead with your question, if you would.
Yes, Congressman, this is Ray. I do not have a question. I follow your work and appreciate that very much. I know both on this telephone call and certainly obvious to so many of us that there's so much pain right now in this area and in the Low Country as well as around the country. And I see your work taking very seriously the kinds of issues and offering leadership in those issues, which I appreciate. But the thing I want to commend you on, when I watch, for example, your campaign ad, which is airing here, with your brothers, your family, there's humor in that. And it's hard to find humor today. And I don't mean a making light of, but rather an ability to sort of laugh at ourselves and to understand that we're all in this together. And I simply want to say thank you for your work, both the serious, hard work that you're doing, but also your ability, your perspective, and your vision that gives you the ability to laugh at yourself and to help us find some humor. Thank you.
I appreciate it, Ray. I hope you and yours are staying safe and healthy through all this as well.
Congressman,
appreciate those kind words.
Yeah, I think we're running out of time. So if you want to lead off with anybody who wants to have final comment with you wrapping at the end, that would be great. I want to remind folks that whether they got a question in or not tonight, you can leave us a voicemail at the end. You got to leave us contact information, such as your email address, your phone number, your name, so we can get back to you as soon as we possibly can. We got to have that contact if you want any information back. And thank you so much. Congressman Cunningham, bring us to the finish line, if you would, please.
Yeah, I want to step in here, and I want to give Mayor Habib a chance before I close it out. I want to thank Mayor Habib for giving us his time tonight to be on this call for his constituents in Goose Creek, for his public service to Goose Creek. Let them know how much we appreciate that, especially during the face of this pandemic. It's good that we have strong leadership, and appreciate you jumping on here. Mayor Habib, you have a few words you may want to share before I close this out?
Well, really just thank you, Congressman. I really appreciate having been able to work with you for the last couple of years, that we have, when we have like concerns, and so when we're able to work together to meet those. But I did want to say one thing very quickly, if I can. we had a project here in Berkeley County in the city of Goose Creek that we were able to attack one small part of it while we were working on the larger part of it. And it's interesting, as I think you alluded to it, and I would just encourage you and the rest of Congress and the Senate to recognize that incremental improvement or incremental change is still improvement and it's still change. And so you do what you can when you can. So again, I appreciate your thoughts on that as well, and I appreciate you guys having me. Thank you so much.
Thanks again, Mayor Habib, and I want to thank Todd from the South Carolina Department of Employment and Workforce, Dr. Traxler, as always, with DHEC, Brian from the Metro Chamber of Charleston. Thank you so much for giving your time tonight. This has been very helpful. I hope everyone's staying safe during this storm and that everything's buttoned down, and that you all continue to monitor the weather and monitor social media platforms to follow the latest. And I want to encourage you all, for those of you whose question we may not have gotten to, our office is open and available for phone calls. If you want to give us a call tomorrow morning, 352-7572. That's the office in Mount Pleasant. We're going to continue working for more relief for the Low Country small businesses and individuals. We're going to continue to bring people together as we have a proven track record of doing that. In crafting legislation, passing legislation, even having it signed into law. But that's been the honor of my lifetime to represent the 1st District, and even through the